Welcome to age 65. 65 is one of the most crucial ages in retirement planning. That when you reach age 65, that's when you're eligible for Medicare. Medicare is the federally sponsored insurance program to help us that as we age and we no longer have insurance, health insurance through an employer, it's a more economical way for every senior really to achieve health insurance coverage. So let's run through what all the parts are of Medicare that you'd be eligible for and the implications of that. Hospital coverage, Medicare Part A. This covers inpatient hospital stays, skilled nursing facility care, hospice care, and some health insurance care services. Most people don't pay a premium for Part A if they or their spouse paid Medicare taxes while they were working. Medical insurance, Part B. Part B covers doctor visits, outpatient care, preventative services, and some medical equipment. There's a monthly premium for Part B, which may vary based on your income. And this comes right out of your Social Security that would come every month. Prescription drug coverage, Part D. Part D helps cover the cost of prescription medications. These plans are offered, however, through private insurance companies approved by Medicare. Premiums and coverage can vary between plans. But please note there is a penalty. Medicare calculates a penalty for Medicare Part B by multiplying 1% times the national base beneficiary premium. So in 2025, that's $36.78 times the number of fully uncovered months in which you didn't have Part D or another credible coverage. So essentially what that means is if you retire and don't have any other medical insurance coverage that covers prescription drugs, and then want Part D later, so there's a gap. You didn't have it through an employer or through a self-pay prescription plan, you could be charged a penalty for the number of months in which that gap existed. Medicare Advantage, Part C. Part C, also known as Medicare Advantage, is an alternative to traditional Medicare. It combines Parts A and B coverage and often includes prescription drug coverage. Advantage plans are offered by private insurers and may provide additional benefits like dental, vision, and fitness programs. So yes, please note that Part A and Part B do not cover dental and vision. Supplemental coverage or Medigap. Some people choose to purchase a Medigap policy to help pay for costs that original Medicare doesn't cover, such as co-pays, co-insurance, and deductibles. Again, these are offered by private insurers, and you will have to qualify, and those costs may vary. Preventative services. Medicare covers many preventative services such as screenings for cancer, diabetes, cardiovascular conditions, as well as immunizations and annual well visits. Your access to providers. With Medicare, beneficiaries can choose any doctor or hospital that accepts Medicare patients. There aren't the traditional, what we think of as networks, and referrals aren't required for specialists. A guaranteed enrollment period. The initial enrollment period allows individuals to enroll in Medicare during a 7-month window, beginning the 3 months before you turn age 65 and ending the 3 months after you turn age 65. So if you include the actual month in which you turned age 65, you have a 7-month window. Missing this window may result in penalties or delays in coverage. Financial assistance. Medicare offers financial assistance programs for those with limited income and resources. These programs help cover premiums, deductibles, and other out-of-pocket costs. So have you seen there's really quite a bit to Medicare. And so if you need help, seek out an insurance professional, a financial advisor, or someone well versed in Medicare, because it can feel daunting to try to kind of navigate. So best ways, roll up your sleeves. If you have access to the website, take a look there. And if we can help, as always, click the link below. And you take care, be well, and hopefully we'll talk to you soon.